Hello, everyone. I'm Joanne Montgomery, a public health nurse from the Infectious Disease Program, and I'd like to introduce you to another member of our team, Alicia Stewart. Alicia has been in the healthcare field for several years and with Southwestern Public Health since 2021. She began working with our COVID community team and soon after transitioned to our infectious disease team with a focus on congregate living. Alicia will be discussing COVID testing, and please place any questions in our chat and she will address them following her session. So take it away, Alicia.
So yes, I'm going to be presenting the self-swab kits that we do provide that you can order through Southwestern Public Health through your lead investigator with your facility. And so for the outline, I am going to go over the intended use, the package contents, and how to complete a requisition and labeling of the swab collection and just the process that you would complete, and then any potential conflicts that may arise and that have arisen, and we've kind of dealt with them as we've all learned through this process. So, what are the self swab kits and their intended use? So, they are an oral and nasal swab collection provided to congregate living settings for confirmatory testing. So, it is different than a rapid test, which are accepted for outbreak management purposes. However, as per the ministry guidance, they should be followed up with a confirmatory test. And so, like I said before, these are kits that you would order through Southwestern Public Health lead staff that the home is working with. So the kits do help facilitate a timely confirmatory result of the residents and staff, especially for homes that don't have the internal resources or directives to complete a PCR or specimen collection for COVID-19. So, the intended use is for residents who are capable of being supervised and guided by their support staff. So, sometimes this does mean that it's more of a hands on assistance. So, you may need to help them, bring their hand to their mouth or bring their hand to their nose to help do this swab completely or correctly. Sorry. And then, of course, the swabs are sent to the laboratory for diagnostic testing. So, what do the kits contain? They come in a biohazardous bag, which will have the package swab and the specimen collection tube. So, the lead investigator for your facility will also provide you with a pre filled out test requisition, which I will show you on the next slide. So, this is the test requisition that you would get through like through email, and basically we'll highlight all the areas that do need to be complete from the facility, and we will kind of fill in the areas that we can complete on our end, such as the outbreak number or the facility name and address, stuff like that. But you do need to make sure that you fill out all the patient identifiers um, that are highlighted just to the right there, and that they do match the requisition and the collection tube. And then to collect, so how to collect a COVID-19 oral and nasal swab. So this is the checklist. It's um, just a diagram so you can visually see where you need to collect the specimen from. So it is collected orally first, and you would do the swab near the lower jawline and in between the cheek and the gum line there. And you would do both sides, and then you would do the nasal cavities as well, both sides. So the checklist, I'll show you on the next screen. There we are. So this is the checklist that we would provide to the facility. Normally, when we email you the requisition, we'll also provide this checklist for you. It's just a good, something to go through, make sure that you're hitting all the points that you need to, making sure that everything's filled out correctly, that you have the knowledge, skill, and judgment in order to perform the test. So then some potential barriers and questions that may arise during the swab collection process, I'm going to just answer those in the next following slides. So if my client tests positive on a rapid, what are the benefits of following up with a confirmatory test? So I do want to note that negative rapid results should not be used independently to rule out COVID in an outbreak situation, just due to its limited sensitivity and the increased pretest probability of COVID-19. If a rapid is used for a staff or resident with a symptoms or an exposure, it would be used only in extraordinary circumstances when a timely PCR testing isn't available. So it should always be followed, like performed in parallel with the PCR testing. So rapid tests and the confirmatory testing, the basic differences is the rapid test is untraceable, but the confirmatory test is traceable. So, say a resident, is transferred in the community to another home, the rapid test results, or when they were rapid positive, could be lost in the shuffle, and the new home may not be aware of the client's previous rapid results. If they are tested with the confirmatory, then the health unit can determine if they were previously a positive case. It all gets uploaded into our database, so we're able to see the electronic health record. Any health unit can determine this. So then the CT value is very helpful. So with rapid tests, of course, you can't get a CT value. You're not, bringing it to laboratory for diagnostic testing, but the CT value is helpful if we're ever determining whether or not a client is a reinfection within that 90-day time frame. And so the rapid test can produce false positives and false negatives. And as we all know, that the confirmatory test is more accurate, and it's better evidence to support any questioning of the swabs as well. So is the self-swab a controlled act? So I've had this question kind of come up a few times during outbreak investigations. The self-swab is not a controlled act. So as you can see from the CNO, basically, if you're putting an instrument, hand or finger beyond the point in the nasal passages where they normally narrow, that would be a controlled act. And an example of that is like a nasogastric tube that's going into the stomach. We're not doing that. We're just going just till we meet resistance. So we're not going past those narrowing of the nostril or the nasal cavity, sorry. And then, of course, Ontario Health also provides an example saying that the collection of an oral, throat, anterior nasal, deep nasal swab, and saliva are not controlled act and therefore can be performed by anyone with appropriate training. Of course, you're going to want to make sure that you guys, that all the facilities have a policy in place regarding the self-swabs as well. So then other questions that might come up, what if I feel my client did not complete the swab properly? So say your client, halfway through the test decides I don't want to do this anymore. I refuse, and they've only completed like the oral portion of it. You're going to send it anyways to the swab or to the lab, because the laboratory are the ones that will determine if there's enough specimen on the collection swab. And then if there isn't, then it will come back inconclusive and we can figure out next steps. And what if a client compromises the test in some way? So if it's dropped on the floor or the contents of the collection tube are spilled out, you will unfortunately need to do a new swab, just because it can be contaminated. And then as well, it needs that buffer fluid in the collection tube in order to be processed properly.
Okay, and if any questions come up a little bit later, you're welcome to contact us. And of course, you'll be getting this recording as well, so something else may come up at that time. So thank you very much, Alicia.
Thank you.